Knee problems are a common source of both pain and disability. Knee problems can be either injury related or functional, and they can occur in older people and frequently occur in much younger people. Let me differentiate between injury and functional problems. Injury is what we would commonly think of as something that occurs at an immediate period of time, such as a trip and fall, a car accident, or a sports injury. Functional problems, on the other hand, are something that occur slowly over a period of time. And these problems are related to improper function in the body, or improper way that we're moving. Think about it this way. Imagine a person who wears out the inside of their shoes over time. What they're doing is causing micro injuries to the inside of the shoe, which occur with every step they're taking because they are not stepping correctly. Over the course of 6 to 12 months, you can see visually the damage to the shoe caused by those micro injuries over time. Those same people are also causing micro injuries to their joints, tendons, and ligaments because of the extra stresses placed on them due to the improper function. Those improper functions most commonly are going to be walking or running incorrectly. The first thing you're going to notice with functional problems is pain, and eventually, if it goes on long enough, you can develop structural damage such as arthritis that becomes permanent and not fixable. What I'm trying to do on this channel is help you to understand how to function properly so you can avoid functional knee pain as well as pain in other parts of your body. In addition to describing some common sources of functional and injury-related knee pain, I'm also going to talk in this video about the proper function of your knees when you're walking. If you like this video, make sure to click the like button. Also, subscribe to the channel if you're not already a subscriber, and click on that join button so you can become a member. Let me interrupt with a shameless plug for my membership program. If you are finding the information on this channel helpful in your life and unique information that you cannot find anywhere else, you can support this channel by clicking on that join button and becoming a member. Members get extra perks, but more importantly, they're showing extra support for the information that I'm providing. I've opened up a couple different membership tiers so you can support this channel for as little as 99 cents a month. So if you're finding this information helpful in your life, I encourage you to become a member, and I hope to see you soon. Now back to the regularly scheduled program. I'm not going to spend too much time focusing on injuries because I really want to focus more on function. But let me first describe several types of injuries that people can get that result in knee pain. First, we have hyperextension injuries. That is where your knee is extended beyond its natural range of motion. This often occurs when people are reaching out excessively when running and planting the heel with a locked knee. Another type of injury that people get commonly is a lateral stress to the knee, where they are either hit from the outside or the inside of the knee, causing the knee to buckle in or out, depending on which direction they're hit from. We do not have significant range of motion laterally in the knee because the knees primarily bend forward and back. So when we're hit from the side, that is going to cause significant injury, and this often occurs in contact sports. A third common type of injury people get either in sports or even sometimes while walking or normal running would be a fall with a planted foot and a twist of the knee. When your knee twists, when the foot is planted and cannot move off the ground, this results in a twisting force that can cause both meniscal injuries and ligament injuries in the knee. Now let's talk more about functional knee pain. Functional knee pain, as I described before, is due to repetitive micro damage caused by improper function of the body, primarily when we're walking, but also when we're running sometimes. The problem with functional damage from walking is that we can't really stop walking. We have to be able to walk to perform our normal daily functions. That's different than sports or running, where we can really do a sustained period of rest from those activities to allow the body to heal. The most likely time to cause functional damage in the knee is between the time of heel placement and the time the forefoot hits the flat position. That is when all of the weight is loaded onto the foot and onto the knee. Changing weight correctly is going to create symmetric, even forces throughout the knee joint that are not going to cause damage. But when we place the weight either with too much impulse or with incorrect alignment, we're going to cause damage over time. Now, most of my other videos I focused on the core movement because all of our movement does get generated from the core. The knee actions are not something you are going to focus on consciously. You have to focus on your core, and if you move your core properly, then the knees will move properly. But it's a good idea to understand what the knees are doing when we're moving so we can understand what's going wrong when we're getting knee pain. One of the most important things about your knees and keeping them healthy when we're walking is keeping the knee lined up over the ankle when we are taking our weight on that leg. If we have our knee to the inside because our ankle is pronating or the foot is flattening out, we're going to be causing stress not only on the inside of the foot, but we're also going to be causing stress on the inside of the knee. If we have our knee towards the outside, when our ankle is supinating or turning towards the outside, we're going to be stressing the outside of the knee. The more common issue people have is stressing the inside of the knee, and that's why knee arthritis on the inside of the knee is the most common location, and that's often due to incorrect walking technique.
Keeping your knee lined up properly is going to require changing weight correctly. If we push the body forward with our rear leg and pitch the body like that when we're walking, we're not going to have a chance to change weight correctly. When we change weight correctly, we're using the lower abdominal muscles to tuck and rotate the pelvis to the outside, and that is going to bring my knee from this position, and when I do the tucking action, it's going to line my knee up correctly. We can even practice that by relaxing the lower abs and letting the knee roll to the insides, then tuck the lower abs and see how the knee lines up in the correct position.
This tucking action is what we're going to be doing as soon as the heel hits the ground, and that is going to bring my knee lined up with the ankle. If we push off like this, we are not able to do that tucking action in time to protect the knee position. So weight change is a critically important time of the step to make sure your knee is aligned in this way. If we are leaning forward when we walk, then you're going to have your knee pitched out over the front of your feet as your weight's put on it, and that is going to cause a lot of pain in the front of the kneecaps. This is what's often a cause of pain for young people who are getting functional or dysfunctional knee pain, a medical condition called Patellofemoral Syndrome that leads to pain right underneath the kneecaps. That is often from the sort of function you will see students with a backpack walking pitched over like this. Their weight is slamming into the front of the kneecap as they go. So it is critically important to walk vertically at all times, placing, changing weight, placing, and changing weight. I know a lot of people on YouTube talk about using your glutes and feeling your glutes when you're walking to push off when you're stepping, and usually they do not do a very good demonstration of what that looks like, but that does not look like short strides. Imagine if we are pushing off with your glutes, you're going to get that. You get a lunge. That's what using your glutes from this position is going to do. There's no such thing as pushing off with your glutes and taking a short step. So what we need to do when we're walking is take a proper step with proper body alignment, vertical posture, with that sort of leg swing, so we are not pitching over. The heel hovers above the ground, then places, then we change weight. Hover, place, change weight. We do not lean over at any time. If you hear somebody say you have to lean forward to get yourself going, or you should at all feel a falling feeling as you're walking, that is misinformation, and do not listen to it. We should not and do not need to lean forward even the slightest bit. You do not need any forward lean to start walking. You simply need the proper rotation to start walking. Any forward lean is going to lead to improper posture. It is impossible to lean even a little bit and land in a lean and keep your posture. As soon as your heel hits, if you have a lean, you are going to break your posture. It is impossible to land and then upright yourself after that happens. The posture needs to be vertical at all times as we are walking. That is going to help protect your knees. Now let me talk about the knee function as we're walking. And there are going to be 3 phases, which I've discussed before, in a normal gait. And the knee action is going to be different in each one of those phases. First, we're going to have our weight change portion of the step, which is after the forward heel places. During the weight change portion of the step, the knee on the forward leg is going to actively flex. It almost serves towards pulling our body forward as the knee flexes with the hamstrings. This is a reflexive action caused by the proper rotation of the upper torso and tucking of the lower torso that is going to trigger that knee flexion automatically. A key part of this, right before the heel hits the ground, is to make sure your knee is not hyperextended, because your swing leg knee is not in active extension during the swing through. When we're in the swing through, my standing leg knee is actively extending, my swing leg knee is totally passive. So when people tell you that that sort of thing is unnatural with a heel strike, that people are walking like that, nobody walks like that. Nobody walks with a locked out knee. That is completely wrong. That is a completely wrong idea about walking. So if people are using that to justify not using a heel strike, they're just giving you misinformation. Nobody walking with a heel strike walks with a locked out knee. If you are, it means you're walking incorrectly. Your swing leg knee should be passively extended and ready to flex at a moment's notice when you're walking normally. And as soon as the heel hits the ground and you tuck, the knee is going to naturally flex. There's no impact on a locked out knee at any point in time. I'm going to turn sideways and walk a little bit, and you can see that as soon as the heel hits the ground, the knee is going to flex naturally, and that is a reflexive reaction to the core movement and does not require any conscious thought. We don't have to time it naturally. All we have to do is hit and tuck at the same time, and the knee will flex automatically. Again, make sure the points to watch for is the vertical posture and also the heel hovering over the ground just before the weight change when you bring it down, not pushing or driving into the heel. If you drive into the heel, you're going to be much more likely to injure your knee. In the initial swing through phase of gait, our active knee is going to extend, and that's going to be the same knee that was flexing during the weight change or loading response. Let me show again. Flexing knee. As soon as the foot hits the flat position, we're going to begin the swing through phase of gait, and that is when that knee is going to actively extend. So our active knee is always going to be on the side of the weight-bearing leg. During the loading response or weight change, the active knee is flexing, and during the swing through, the active knee is extending. The whole time, This left leg, which is going to be my swing leg, this knee is passive. It is neither extending or flexing actively. You don't have to think about it. It's going to move on its own. And the final phase of gait, which is the heel lift portion or terminal swing, when I bring my heel down, the forward heel, and the back heel lifts off the ground, we are extending the standing leg knee still, but we're actually going to extend it a little more. And again, this is going to be a reflexive reaction to the rotation of the core that is going to bring my heel down. At the same time, it's going to cause my rear knee to extend further, and it's going to cause my rear ankle to plantar flex, bringing the heel down, and then I'm going to transfer my weight by flexing my forward leg knee. So it is critically important, as I've already said, that we walk correctly in order to keep the knees healthy. So many people, even at a young age, develop knee pain due to this incorrect walking technique. And if you are one of those people, recognize that it needs to be corrected early, because once the damage is already set in, it can be very difficult to change. It can be very difficult to fix, or really the damage is not fixable. You kind of have to live with it, and ultimately you may be in need of a knee replacement at some point to get a new joint. It is so much better to prevent that from happening by learning how to move correctly when you're young. I think it's a fortunate thing that most of the subscribers on this channel, or a great majority, are young people in the 25 to 40 year age range. And that is a good age to recognize if you're having an issue and try to correct it. I'm not saying that you can't correct it when you're older, but it becomes much more difficult, and there may be already structural damage already done that is not going to be able to be fixed. So if you're in that 25 to 40 year old age range, it is a perfect time to fix your gait so your knees can remain healthy for the rest of your life, and you don't need me to be giving you cortisone injections and then referring you for a knee replacement surgery. So I hope you enjoyed this video. If you did, click the like button, share the video, and subscribe to the channel. If you're not already a subscriber, hit the join button so you can become a member and show that you are finding this content valuable to your life. Thank you so much for watching.